We start today's program in the United States. Recently, the Tzu Chi Medical Foundation hosted a TEMA camp in hopes of strengthening and expanding their collaborative efforts nationwide. 236 TEMA volunteers gathered at the Tzu Chi U.S. headquarters in San Dimas, California, to exchange information about their operations, as well as to identify and refine SOPs in the hope of serving even more people around the country.
Since its establishment in 1998, TEMA's medical outreach in the United States has been mostly limited to California. However, with an increase in volunteer numbers and the need for basic access to healthcare, the Tzu Chi Medical Foundation hopes to broaden the scope of medical services across the country.
Most of the challenges we always hear is they have no malpractice insurance. We used to have a restriction on the malpractice insurance, but now we have a national malpractice insurance to let them go out and do outreach.
Apart from exchanging their views and ideas, camp organizers also brought in a Tzu Chi mobile van for participants to take a closer look.
So I didn't realize that the mobile clinics take so much manpower and financial assistance and volunteers and doctors to come and run it. So it seems impossible to do, but it's really amazing. Hopefully New York can build up all the manpower and volunteer to one day have our own mobile clinic.
Biggest challenge is the mindset. Hopefully within 5 or 10 years, we're going to add another 10 mobile vans. And also we're going to build a few permanent clinics throughout the United States.
236 people from across the United States attended this year's TEMA conference. The theme this year is embracing a new era with compassion and integrity. To reach this goal, Tzu Chi will need to rely heavily on professional volunteers to provide a high level of quality assistance. But there is also another key component to achieving success.
We need professional volunteers, doctors, dentists, acupuncturists, but we also need non-professional volunteers because we need those volunteers to dedicate themselves to know the logistics.
To teach participants about the logistical planning of a medical outreach, TEMA invited volunteers from Fresno to share their experiences.
Because in Fresno, we only have 11 commissioners and one Susan, that is me, one guy. Okay? So we cannot do all the work. So we invite some members from San Jose, Santa Rosa. In this event, we pull out close to 400 volunteers, including doctors. Okay? So anybody can help as long as you give them a chance and train them.
Some of the ways that non-professional volunteers can help out at an outreach can vary from when patients are coming in, simple thing as greeting them. That way they feel welcome, that way they start to feel like they're in a familiar place. There's always going to be the booth where they'll learn more about Tzu Chi and its mission.
Part of the workshop, we explain to doctors how the outreach function compared to private practice.
I'm a cardiologist, and in the hospital, patients, they come to me. They ask for help. In the outreach, I'm the one to go to them to ask for help. I ask them the opportunity for me to improve myself.
Some of the Fresno volunteers even put aside their own personal time to attend the conference.
I was on vacation in Newport, Oregon, so I drove all the way down on Thursday, 24 hours actually, to get here because, when I volunteer with them, there's always that sense of joy and happiness, and I guess I just wanted to see if that was true for the whole organization.
Arina, you tired? Mm-hmm. Oh, that's okay because it's almost the end now. But do you learn anything?
I don't know.
What do you learn? Do you like the presentation that they do?
Yeah.
At the end of the day, from the young to the old, we hope that all these volunteers will learn from this conference and will bring back what they learned to their community and apply to their local outreach.